Hey, hello everyone. My name is Sara Bader, and I'm the Senior Manager of Upstream Quality Improvement at HealthBegins. And I just want to extend a thank you from all of us at HealthBegins for joining us today on this webinar entitled, Are You Ready to Go Upstream? So before we start, just a couple of housekeeping items. We'd like you to know that this webinar will be recorded, and we'll be sending out this recording to all registrants after the webinar. All participant lines are on mute. And if you have a question for us, you can enter it in at any time in the question box that appears on the GoToWebinar doc. And we reserve time at the end of the webinar to answer all questions that come in through that box. And the presentation is scheduled to last for an hour. So thanks again for joining us. And with that, I would like to turn it over to Dr. Rishi Manchanda, the president and founder of HealthBegins.
Thank you, Sarah. Appreciate that. And hi, everybody. Rishi Manchanda here. I am, as Sarah mentioned, president of HealthBegins. It really is a pleasure to join you guys today. Let's talk about the learning objectives that we hope to address today with each of you. We'll start by talking about an approach that we take at HealthBegins to helping organizations in healthcare and in the community to move upstream. We're hoping that together with you guys today that we'll also educate you about 10 domains that we think are really relevant for assessing the readiness of an organization to move upstream. In other words, to address social determinants with clinical and community partners. And then finally, we'll hopefully by the end of this webinar, help you identify how you can help healthcare systems and their partners in the community to get ready to address health-related social needs. And before I hand it over to Sarah, I just want to make a personal note here. This is a meaningful day for me, not only because I'm here with Sarah, but because, as some of you know and some don't, I'm a primary care physician and I've spent the bulk of my career working with underserved populations, first in South Central Los Angeles with working families there, then with homeless veterans at the VA system, and then with farm workers actually in the Central Valley of California. And what I learned in those administrative and leadership roles was that they're incredible folks on the front lines of healthcare around the country. And many of them share the same commitment that we at HealthBegins have, and I'm sure many of you have, which is a commitment to making sure we do the best possible for those who have the least. And when we reflect on the experiences over the last several years, personally speaking, I know that it's been meaningful to see that the idea of moving upstream is not only necessary, it's also possible. And this last year, HealthBegins has gone from what was initially a labor of love, something that group of colleagues and myself started 5 years ago, nights and weekends, trying to put together trainings and materials to support our peers. And it's now in the last year become HealthBegins 2.0. We're now a full-time operation with folks like Sarah and others on the team. And so really excited about the chance to join you guys today in what is going to be the first of a series of webinars over the course of this year and beyond to help us all learn how we can move upstream. So Sarah, with that, let me turn it to you.
Sure. So before we get into any real depth here, we want to find out, who we have on the line. So there should be a polling question that pops up. And what type of organization do you represent? And we have a couple of choices here. We know this isn't all-inclusive. So feel free to select one if it applies to you. If it doesn't, feel free to type it in the chat or questions box. Okay. Why don't we close out that poll? Great, so it looks like 33% of you are from community-based organizations, which is great. Thank you for being on. We have 23% from academia, 24% from a hospital or health system, 14% from a clinic, and then 6% from a health plan. So this is great. We have such a great diverse audience on the call. So thank you all again for joining.
So we wanted to begin today actually giving you a little bit more perspective on HealthBegins. I gave you the origin story in a nutshell, but what we're up to these days is nothing less than trying to drive radical transformation in how we provide, pay for, and practice upstream care. We, in a nutshell, help clinical and community partners to move upstream with expert coaching and facilitation from folks like Sarah and myself and others. We provide technical assistance and tools, and we provide a lot of educational and quality improvement programs, including today's webinar. We're proud to have clients and partners across the country, including the ones mentioned here. And last year, we're proud to have been selected as part of a team of technical assistance providers to support the CMS Accountable Health Communities model and the grantees across the country. Our core team includes those bright, shiny faces you see there, including Sara, our Senior Manager of Upstream Quality Improvement, and others. And what we're really proud about is the fact that we're taking that core team and supporting a growing network of partners, as you can see at the top, and lucky to have the input from a growing list of advisors, senior fellows, and increasingly a network of consultants who are subject matter experts who have the years of experience in the front lines of healthcare transformation, including some of the folks you see there, like Victor Tabush, Kathy Baz, Dennis Shea, and Leslie Scotland Stewart. So it's been an exciting year for us in terms of growth. I wanted to turn over to Sara now to talk a little bit about what we're all trying to do together in this team.
Yeah, I just want to take a moment just to kind of center us about kind of why we do what we do. And for those of you who are familiar with the Quadruple Aim, it's something of a compass that kind of guides organizations to that true north of optimizing health and performance. But if you're not familiar with it, just to give you a little bit of background, it was traditionally the Triple Aim and included 3 domains, so improved patient experience, improved outcomes, and then lower costs. And recently, that 4th domain of staff experience or joy at work has been added in to kind of complete the Quadruple Aim. And I think we would challenge ourselves collectively to think that we can never fully achieve the Quadruple Aim if we don't also consider the advancement of health equity and consider how we can influence societal opportunity and decision making and structural fairness. And that it's not just enough anymore to talk about it or be mindful of it, but also to begin to consciously act upon it. So you're probably thinking like, okay, yep, I get it, I'm on board, this is what I want to be doing, but how do I actually do it? And we've seen that a roadmap can be very helpful to activate and get moving on this work. And so at HealthBegins, to build upstream capability and impact, we use a really simple approach, which is just to get ready, get set, and then go upstream with quality improvement. And so today, we're going to be focusing on that first step on the roadmap, that get ready. So how do you know if you're ready to go upstream? And a core component of getting ready is to figure out what your organizational level of readiness is to effectively address social determinants of health. So go ahead, Rishi, do you want to talk about the Upstream Readiness Assessment a little bit?
Thanks, Sara. Yeah, so as we think about the get ready, get set, go process, of course, it's really key to start with getting ready. And that's where today's focus obviously is with the Upstream Readiness Assessment. So we're going to talk about this for the bulk of today, about how we can complete an organizational readiness assessment. It's an online tool that we've developed to identify strengths and to identify areas for improvement in 10 domains of performance. So I want to give some background first for us all to provide context for the need for the Upstream Readiness Assessment in the first place. So I think the first question, of course, is why do we need to address health-related social needs? And of course, there are many reasons, but increasingly one of the most relevant reasons is because it's continuing to define now what the most effective health systems are doing and will need to continue to do as more and more standards and funding requirements come along, whether it's the NCQA standards for the patient-centered medical home, the newest updates to the health plan accreditation standards for population health management, again from the NCQA, the work that we referenced earlier with this CMS Accountable Health Communities model, or across the country, the increasing inclusion of social determinants of health into the design and the requirements of state Medicaid waiver programs, the 1115s, and the district programs as well. So we know that it's important, of course, to address health-related social needs. And in that context, why is it important to assess organizational readiness? There's so much that's happening right now and an awakening to the importance of social determinants. We can sometimes forget that one of the components to understand how to do this effectively is to focus in on organizational readiness. We know that it's important to look at organizational readiness because much like other major changes in healthcare delivery, especially when there's been great promise, we know what's required is not just a new tool, a new app, a new program, What's often required is the collective behavior change within and across organizations. In other words, what's needed, of course, to support the effective implementation of promising approaches to improving healthcare is complex systems redesign. And we also know that while there is an increasing interest and work going on to identify the evidence-based interventions to support the ways to move upstream, that evidence-based interventions, while necessary, are insufficient. There's always a gap, and there always has been a gap, between evidence-based intervention strategies that are endorsed by various organizations and the realities on the ground, the realities of implementation in practical settings. And so closing the last mile between evidence-based interventions as we grow our understanding of what works and what doesn't, we have to recognize that closing the last mile is still a major challenge. As we develop evidence-based strategies, how do we actually implement those in practices? To do so requires an understanding of an organization's capabilities and context, as we found. So let's define organizational readiness. When we, over the last 5 years, actually with HealthBegins, were looking at what it takes to build an organization's capabilities to move upstream, we looked at organizational development theory, we looked at implementation science, and we looked at our own experiences as well of what it takes to actually make change happen on the ground. One of the organizational constructs that I found personally to be most meaningful is something developed by Abe Wandersman and a few folks over the last several years, and that's the R equals MC squared. It's a great, easy enough to remember mnemonic to think about what goes into organizational readiness. Organizational readiness with the R equals MC squared framework includes the motivation to implement an innovation, such as addressing food insecurity or housing insecurity. Another component of organizational readiness is the understanding of the general capacities of an organization, their infrastructure, how well managed they are. And lastly, the other component of organizational readiness is to look at innovation-specific capacities needed for that particular innovation. So in this case, the specific capacities needed to implement a program to address food insecurity or to address housing insecurity and so on. That R equals MC squared construct is helpful as we look at these components that I think increasingly we're seeing with our partners across the country, and that is that it's not just enough to have a willingness to address food or housing insecurity or other social needs. We also have to be able to do that. We know that organizational readiness is a necessary precursor to successful organizational change, and that, of course, with the way we work at HealthBegins and with our partners across the country, we know that this concept of readiness is embedded and must be embedded within larger program planning and implementation frameworks. So with that wonking out, I wanted just to translate how this all came to bear as we developed the Upstream Readiness Assessment. So as I said, we reviewed best practices and constructs, some of which I've already described. We iterated the readiness assessment with input from dozens of administrators and experts and practitioners in health and in healthcare. And then over the last several months, especially over the last couple of years, we had opportunities to take earlier versions of this and road test this with clinic leaders and have really benefited from the input from folks on the front lines in healthcare. So with that in mind, I want to hand it over now to Sara.
Yeah, so thanks, Rishi. So I think it's great that this is rooted in science and it's important work that we're doing, but we're trying to make this easy for you. So let's give it a try. We've built out this Upstream Readiness Assessment as an online tool that you can complete through your mobile device or your computer. And it only has about 25 questions for organizations to go through to self-assess your readiness to go upstream. So why don't we give this a try? So we'll walk you through a couple of steps to get you thinking about what your own self-assessment might look like. So the first step is to focus. So think about one specific priority population served by your organization and one health-related social need which impacts that population. So it could be adult diabetics and food insecurity, or children with asthma and substandard housing, or maybe it's elderly people with cognitive impairment facing social isolation. Just a note, however, why do we suggest that people only focus on one? Because I'm sure you're thinking, well, actually, we have many priorities. We don't only have one. And I think for many health systems, it can feel hard to pick just one population and one social need. And we've designed the assessment this way to help you focus as you uncover your organization's strengths and areas for improvement. So don't worry, when you complete the assessment, you can and should really retake the assessment with other populations and our social needs in mind. So we want to pass it over to you and get you to start thinking. We're going to open a polling question here. And so with your own organization's strategic priorities in mind, pick one population for the purpose of today's exercise. So again, this is not an all-inclusive list. We've just picked out a couple that we found to be common. So let's see, let's give you a couple seconds to complete that. See, results are still coming in. Great, I think we can close the poll there. So it looks like actually 43% of you are focused on high cost, high need patients, 30% on adult diabetics, 13% on elderly patients with depression, 9% on children with asthma, and 5% on dual eligible. So again, you can see there's kind of a wide range of populations who are needing and would benefit from upstream work. But now that you've identified a specific population, the next thing we ask you to do is to pick one social need or social determinant which you believe is having an impact on the lives of that group of people. So we'll open this poll question as well. Great, and again, same thing, this is not an all-inclusive list, but it's just about kind of focusing yourself and picking one. So I'll give you a couple seconds to go through that. Great, I think we can close the poll out there. So it looks like we're about tied with 28% of you identifying food insecurity and financial insecurity as a health-related social need impacting your priority population, with housing insecurity at 20%, and then social isolation at 14%, and transportation at 10%. So with that, Rishi, I'll pass it over to you to discuss next steps.
Thank you, Sarah. So the next step after focusing on one specific population and one particular social need, and again, respecting that organizations have multiple populations with multiple needs in mind, the purpose of this is to go through the exercise with a specific group of people in mind and a specific social need so that you can identify areas of strengths as well as for improvement in your organization. So the step after focusing, as Sarah walked us through, we want to now assess your readiness across 10 different domains. These 10 domains were pulled from the review of organizational developmental theory and the other constructs I mentioned earlier. They include, starting from the left and moving across this ray of sunshine here, it starts with the external environment, moving then to understanding the perceived value of moving upstream within an organization. This is a key factor that oftentimes we miss in identifying whether we're ready to move on any business change. The third domain is executive sponsorship. That includes not only C-suite level support, but also support from your board of directors and advisory board members. The fourth domain is understanding how well developed your staff and team roles are, especially identifying motivation, capacity, and skills to integrate social determinants into your healthcare practices with your community partner support. The fifth domain is scope of work. How well defined is the scope of work for your planned or currently implemented upstream intervention? The sixth is project management. This goes to the understanding of how your organization in general manages projects. Are you an agile organization that is lean and nimble in terms of getting end user feedback from patients as well as from frontline staff? Or do you use traditional waterfall techniques with the Gantt charts, et cetera, that oftentimes are necessary but can be difficult to operate when you're trying to implement a new innovation? The seventh domain is workflow integration. This gets to questions about social need screening and referrals, how well integrated those processes are into the way information and work is actually structured around the care of patients at your clinic or hospital setting. The eighth domain is quality improvement, and this gets to a big component that we're passionate about here at HealthBegins, which is understanding how well developed your quality improvement culture is within the organization, irrespective of what you're doing for this upstream need. but also how you may or may not be tapping into that experience of quality improvement, the teams and the resources and the methods to be able to drive your upstream innovation. The 9th domain goes to questions of infrastructure, everything from how well aligned your HR policies are, how regularly you practice the best of performance management when it comes to providing guidance and accountability to teams within your department, within your organization, and with your partners. And then lastly, financial readiness. Have you penciled out the risks and rewards, the cost benefit for a particular upstream intervention? For instance, addressing food insecurity for diabetics or addressing substandard housing for children with asthma. And lastly, for financial readiness, have you identified ways to be able to optimize the cost savings or even the revenue that's generated to be able to reinvest into other upstream projects with your community partners? So these are the 10 domains of readiness that the Upstream Readiness Assessment has been designed to address. And with that in mind, we actually want to now just show you finally what the readiness assessment looks like. And before we do the demo, I want to remind people that we're really appreciate all the questions that are coming in the chat box. We encourage you to continue adding those questions in. Please know that we have some time at the end to try to address some, if not all, of those questions. And any questions that we don't get to by the end of this webinar, we'll be sure to follow up on by email. So now let's switch over to show you the Upstream Readiness Assessment. Sarah, you ready?
I'm ready.
All right, so we're going to toggle here and share with you the Upstream Readiness Assessment. And we thought it would be fun today, actually, for Sarah and I to role play to make this a little interactive. So I'm going to be the person voicing over the Readiness Assessment from the HealthBegins perspective, from an external perspective. And Sarah, what's your role going to be today on that?
Yeah, so I'm going to be a chief nursing officer at a mid-sized community hospital called San Diego General Hospital.
All right, great. Well, with that in mind, again, we invite you to think about your own roles within your organizations as we look at this tool. So let's get started. There's some introductory language here that, of course, we've talked about a little bit on this webinar, but reinforces what you've already heard. You'll see the same steps that we've talked about in terms of focusing on one population and one social need. And let's proceed now to take the assessment. So Sarah, thank you for joining us today. Wearing the hat of your assumed persona now.
Thank you for guiding me through this.
Absolutely. So Sara Bader, first and last name here. And Sarah, should we put in your address at HealthBegins? We know you're working with us right now, but for the purposes of this webinar, you're a CNO at your San Diego General Hospital. So Sarah, what's the name again?
Yeah, San Diego General Hospital.
Great.
And by entering my email there, you'll give me reports and things. Is that why?
Yeah, thanks for reminding me. Perfect. So the purpose of collecting the information is not only, of course, to be able to track who is using this tool, but to be able to, as you'll see at the end of this, be able to provide you with the summary report of how well your organization is, how ready you are, where your areas of strengths and areas for opportunity are as an organization.
Great. Thank you.
Sarah, is this the right name of your hospital?
Yep.
Great. So Sarah, could you pick one specific patient population at San Diego General Hospital to focus on for this readiness assessment?
You know, this is tough because I think we have so many priorities, so I'm not sure how to pick just one.
Great, and I really appreciate that, Sarah. You're not alone, as I'm sure everybody on this webinar kind of feels as well. Many organizations, of course, care for multiple populations with multiple unmet, not just medical and behavioral, but also unmet social needs. I think for the purposes of this exercise, as we talked about earlier in this webinar, we want to advise you to pick one population, not because they're perhaps more important than another group of people, but because it's a way to learn how to uncover your strengths and, again, your areas for opportunity, your opportunities for improvement. Okay. So with that in mind, just which one would you pick just to go through?
Okay, so I think given that, why don't we focus on adults with diabetes?
All right, great. Sarah, approximately how many adults with diabetes does San Diego General Hospital care for or serve in a typical month?
Yeah, I think it's somewhere around 600 patients a month.
Great, so between 500 and 1,000, thank you. And Sarah, can you pick one health-related social need that should be or is already being addressed in order to improve care for adults with diabetes?
Yeah, in some of the conversations we've been having internally, we've had a lot of discussion around food insecurity in our adult diabetic population.
So food insecurity. All right, great. And again, knowing that there's other complex social needs,
Right.
but we'll start with this for now. So Sarah, which of the following statements best describes your hospital's project to address food insecurity for adults with diabetes?
Yeah, like I just mentioned, we're starting to have the conversations, and I think in a meaningful way, but we haven't launched yet. So I'd say we're close to launching.
Okay, great. All right, Sarah, we're ready. Let's assess those 10 domains of readiness at your organization, and don't worry, this will be quick. Now, for those on the webinar, of course, I'm going to kind of pause for a moment. It takes about 15 minutes for someone to do a self-assessment. Of course, we're not going to spend that time on this webinar going through each of those 10 domains, so we'll pick a couple of highlights. After doing those introductory questions, now let's go into those 10 domains. We'll start with section 1, the external environment. So Sarah, with this statement, please tell me if you agree or disagree. Payer contracts, for example, with state Medicaid agencies or commercial payers, may support activities at San Diego General Hospital that address food insecurity with adults with diabetes.
Yeah, we're participating in a state Medicaid waiver, and as part of that waiver, this has led to a lot of efforts to address the behavioral and social needs of our patients. So I think that there's opportunity there, but I'm not really sure. So I think I'd put us at around a 3.
3, okay, great. And so Sarah, with that statement in mind, let's look at the next one for the external environment assessment. San Diego General Hospital is partnering with a well-managed social service agency, public health department, or a community-based organization to address food insecurity.
Yeah, we've actually started in some of these initial conversations reaching out to some community organizations. So I put us at a 4 for that. I think we're making progress.
That's great. That's great. So I don't need to even read this over, but Sarah, what is the name, as you can see, of at least one community-based partner with which your organization is working to address food insecurity for adults with diabetes?
Sure, we've had some great conversations with the Food Bank of San Diego.
Great, so let's put that in here. All right. So again, for today, we're not going to go through each of those sections here, but know that, again, for webinar attendees, that each of the 10 domains in the standard version have 2 associated questions per domain, and they go again across those domains of everything from executive and board sponsorship, how well defined your staff and team roles are, scope of work for your upstream project, in terms of how well defined that is, in terms of intervention as well as outcome measures and evaluation. We assess project management as well, as Sarah would do. But let's actually pause just to get a sense of another section that might be relevant for today. So Sarah, again, keeping that persona as you're doing so well as the Chief Nursing Officer at San Diego General Hospital, let's talk about workflow integration. So again, with this statement, Sarah,
yeah,
how would you agree or disagree? My colleagues and I have a clear idea of how to integrate screening and referral processes for food insecurity into our routine workflows of care for adults with diabetes.
Yeah, we've talked a little bit about integrating screening and referral into workflows. I don't know if we've done a good job of really considering, our existing workflows that are working well. So I think I'd put us at like a 2, 2 or 3.
Got it. So even though you've got these relationships with the Food Bank of San Diego at your hospital right now, it seems like this is an area potentially for improvement.
I think so, yeah.
Great. And Sarah, here's another statement. My colleagues and I have a clear idea of how our health IT systems can be optimized to support the collection and management of the data related to food insecurity within our workflows of care for adults with diabetes.
Yeah, this is a good one. I know that our current EMR vendor has social determinants modules, but that we haven't turned those on, or I think at least, even really fully explored that functionality. So I think there's definitely opportunity there. So I'd put us at a 2, I think.
2 right now.
Yeah.
It sounds like with the work that the EMR vendor is telling you about right now, it looks like there's opportunities.
Yeah.
So again, for the webinar attendees, and Sarah, thank you so much for doing that role play. We're going to go back into our HealthBegins hats right now with everybody on the call, and just identify that, again, there are 10 domains here, not only the 2 that we just highlighted, but other ones that go to the ones previously mentioned, as well as quality improvement, infrastructure and development, financial readiness as well. So let's pivot back to what one lesson is that from going through that readiness assessment together. One, as I hope you saw, This is a tool that is mobile and web friendly. 2, it's a tool that allows you to include your specific information for not only who you are, but which organization you represent, which partner you have, which populations you're focused in on, and the social need of interest. And you can see how the tool automatically includes that, so you can get, again, specific. And that's a key message here we wanted to reinforce in talking about upstream readiness, not just with our tool, but I think for what we're all experiencing across organizations committed to addressing social determinants. I think at this moment, and this is now me kind of in a personal statement here, I've been involved for a number of years in thinking about ways to better address social determinants. And I think it's important for, at this moment in the evolution of this work collectively, to recognize that it's no longer adequate for us to talk about readiness or strategies to address social determinants as a general, broad topic. It's time for specificity. It's time for rigor. It's time for the focus so that we can actually truly get past some of the psychological barriers, and oftentimes those are the biggest ones, to being able to engage organizations, whether they're in healthcare or in communities, to think about what they can do. Instead of talking about social determinants, we can engage our colleagues, as we found with HealthBegins, as I'm sure many of you have found. It's easier and better to engage people around specific social needs, like food insecurity, for specific populations like diabetics, than it is to say, are you ready to address all social determinants? So let's stop boiling the ocean when it comes to social determinants. Let's get specific, and especially when assessing your organization's readiness to move upstream. So with that in mind, Sarah, can you walk us through the next step, if you don't mind? What happens next?
Sure. So the next step is to review. So you've gone through this exercise, and part of the role play was just to kind of, walk you through the thought process. And so I think as you're thinking about this, are there areas that are clear opportunities for improvement or strengths? And so Rishi, do you want to talk a little bit about some of the ways in which you can dive a little bit deeper on that?
Absolutely. So when we went through that assessment together, and Sarah, as you would have done if you completed that on your own, as we are with the webinar attendees today, when you go through those 10 domains, as you were watching us describe this, what comes to mind for you? Where do you think you're most ready, not just for diabetics with food insecurity, as Sarah was guiding us through, but for the population that you identified in response to the polling questions? And similarly, where do you see areas or opportunities for improvement? There are clearly strengths as well as deficiencies in all organizations. Even the most high-performing ones have areas for improvement. And that's actually what defines a high-performing organization, of course, is the ability to continuously surface opportunities to improve. And as you're reviewing this, whether it's in quality improvement or workflow integration or those other 10 domains, where do you think your opportunities for improvement might be? What's clear is that when we walk through the readiness assessment, that online tool, it's not enough just to go through the assessment itself, but it's most important to make sure that you receive your report so that you can review and identify your organization's highest and lowest rated competencies. So let's pause here for a moment. When everybody who's attended this webinar actually will, as we'll describe at the end, receive a link to complete the readiness assessment if they choose for their organization. And at the end of that process, you'll then receive from us a summary report for the standard version of the readiness assessment. And in that standard report, you'll see us identify the highest and lowest rated competencies of the organizations. It'll also include some tips to be able to identify ways in which organizations across the country, from our experience, have tried to address those gaps oftentimes in their organizations. And then we graphically represent, of course, your highest and lowest rated opportunities. So I'll call your attention here to the blue line on this polar chart to represent one particular organization's, for instance, self-assessment for upstream readiness. As you can see in the blue here, the organization thought that they had a relatively high level of readiness for the external environment. If you track clockwise, they went to the perceived value moving upstream. It looked like the person who took this thought that there was maybe about 6 out of 10 in terms of the rating, in terms of the perceived value moving upstream within the organization. In other words, they thought that while they may have their own beliefs about the necessity to improve social determinants, they perceived that their colleagues had perhaps a little lower level of perceived value. That's an important domain, again, of readiness. Clockwise again, executive sponsorship. We've seen that perhaps from the board or from a C-suite leader, a degree of executive sponsorship. We see how they rank themselves in terms of how well-defined the staff and team roles are, and again, it looks like it's relatively low, and so on. And so you can see how going through the entire clockwise kind of chart of readiness allows, in that line of blue, an organization to understand its strengths as well as its areas for improvement. What we don't provide in the initial report that folks who receive the link today will get, what we provide later on with HealthBegins and through our partners is the ability to do an external assessment as well, and then of course to allow an organization, an individual in that organization, to be able to compare their own self-assessment with that external assessment to see if there's alignment. And sometimes there is, and sometimes there's not, and that can represent areas for growth, especially to understand how you might benchmark across others. So the punchline for this is, after you focus in on one population and one social need, after you take the assessment, which takes about 15 minutes, then you review your report to identify your highest and lowest rated competencies. In other versions of our report, we allow greater sophistication here, but at least with the summary report that, again, everybody who's on this webinar will get a chance to access, you can then take your results and compare it with colleagues. If your colleague takes this readiness assessment, you can then compare notes over lunch and identify over a working lunch, how did you rate us, and why was your rating different from mine, et cetera. That's an important function, as we see it, for the Upstream Readiness Assessment, and that is to serve as not only an assessment tool in and of itself, but also as a catalyst for conversation within organizations. We invite you to review your results not only with your colleagues, but to now dig in and review results by site, by department, and even by role. There may be medical assistants who have really great insights into true operational readiness that is different from senior managers or medical directors in the clinic, for example. And then finally, in working with us and our partners, we are ready to provide detailed feedback and recommendations, some of which will be included in the summary report, and some of which we provide through phone or other consultations. So again, this report is a way to be able to reflect on not just what you perceive as strengths and weaknesses, but also to identify what your colleagues think, and also to identify how you might compare with other organizations. One of the things that we're working on at HealthBegins is a network of partnerships to be able to now take this Upstream Readiness Assessment and then partner with organizations who want to provide this to their own networks of hospitals, of clinics, their own, whether it's associations, health plans, foundations, et cetera. It's clear that there's an interest, as we found, in assessing the readiness across a whole domain of members or participants in a network. And so what we are able to do in a different version of the readiness assessment through our partnership plan is to allow those folks who take the readiness assessment to be able to compare that with not just the external assessment, as I mentioned earlier, but also to get support and recommendations, not just from HealthBegins, but again from peer organizations who have taken this as well. You might be, again, like Sarah was role-playing, the chief nursing officer at San Diego General Hospital, for example, which is not a real hospital. And you might find that some of your areas for improvement are around staff and team roles or workflow integration, for instance. And being able to actually now benchmark your experience and compare to the experience of others. There may be a hospital in New York or in Texas and other parts of your own state or region who may have greater strengths. And this now allows us an opportunity to have technical assistance offered by peer organizations so that now we can build this ecosystem again of system capability within and across organizations. So we can help you compare results in these different ways by looking at different sites or organizations in your network and then being able to get composite scores so that you can review upstream readiness within and across organizations and regions. One thing I'll also note here before moving on is that the focus of today's Upstream Readiness Assessment has been around the Upstream Readiness Assessment for healthcare systems. And again, that's a reflection in some big ways of the work that we've been doing with HealthBegins for a number of years. It is a focus area for us. But of course, we know and recognize that it's not just about improving the readiness of healthcare organizations to move upstream. That is necessary but insufficient because, of course, this is about clinical and community partnerships. And so HealthBegins and its partners have the mirror image of the readiness assessment for community-based organizations as well. And it's important to recognize that whether it's through HealthBegins or our partners, there are ways to be able to take a similar assessment and offer an opportunity for a food bank, for instance, the Food Bank of San Diego in the example that Sarah gave, or other organizations, to give them that opportunity to be able to take their own pulse as an organization, and then to be able to come to the table with you as a healthcare partner to identify opportunities for you to support each other. We know that it's not just about taking a snapshot as well. Checking your pulse once is good, but checking your pulse over time is key to be able to understand how well you're progressing, to identify the health of your organization and of your partners to be able to move upstream. So that's where we can help you to track and grow organizational readiness to move upstream over time as well. As depicted here, whether it's 3 different hospitals or different clinics or even community-based organizations, it's important, we believe, to be able to track organizational readiness and capability to address health-related social needs over time, to be able to manage that process and to manage that to the goals that you might have for your particular region or community. So Sarah, I want to turn it over to you to actually talk us through what happens after we get ready, which has been the focus of our conversation today.
Yeah, absolutely. So we've spent a lot of time today on this getting ready, but obviously it's not the end of the process. It's just the very beginning. So as you'll see here, so step number 1 is to get ready. Step number 2, though, is to get set. And I think one of the things I just want to stress is that although we've said through the readiness assessment process to get you focused, to just pick a priority population and a social need. But as part of the get set process, what we're not advocating is that you then run, the whole way through this, based on that population that you kind of just picked to go through an initial assessment. But get out there and, validate your assumptions, talk to your partners, talk to your patients, and find out what is it that, matters to them, and to validate those assumptions before you kind of get set to launch an upstream project. And then after you've done that, get ready, get set, and then go upstream and use quality improvement. For those of you who know quality improvement, it's worked well in healthcare for many years to improve outcomes. And so how can we think about how to apply those kind of fundamental quality improvement methodologies like a PDSA or something like that to address those upstream factors to improve the quality of care and the health of patients? And so to support this work, we have a whole host of tools that we can use to coach organizations on doing upstream quality improvement work. And you can see here that the upstream readiness is just one of many that we have available to kind of support you through this upstream process. So just to bring it back around, what are the things you can do next? So what are those kind of small things that you can take from this webinar and begin to consider your own organizational readiness? And as Rishi had said at the beginning, you'll get access to this by participating on the webinar. So go out and complete it. Share it with others. Within your organizations. Maybe yourself and your colleagues have different responses to things, and you can start a discussion in that way. Or maybe share it with a leader. Get your leadership on board about why do we want to start thinking about things that can help us to go upstream, or encourage them to complete it as well. They might have a completely different perspective. And again, I think it just helps to kind of facilitate those conversations as next steps. And then help to spread the word. Find those upstreamists, build your village of people who are committed to this work in the same way that you and all of us are. To kind of get ready, get set, and then go upstream to address those determinants.
So Sarah, thank you so much. Let's, I think we've done a good job walking through the components that we would like to share today, and we're also really overjoyed by the fact that there is actually, it looks like a ton of questions that have come through this. So we wanted to build in time to now address as many questions that you've shared as possible. So we'll spend a few minutes going through some of these questions. And again, if there are questions that you've asked that we're not able to get to during this webinar, please know that we will follow up with you as well. If it's a question that we think has relevance to other attendees, of course, share the answer with them too. So let's start with some of the questions that we have on the list. The first one is from Richard Edwards. Again, thank you for joining us, Richard. The question is, when picking a population, is there better evidence that some populations or problems are more amenable to social interventions than others? It's a really great question, and I think I alluded earlier to the fact that there is growing attention and work done to map out the interventions that are already in place, as well as the evidence to support which interventions work or not. So we are proud to be partners with several academic organizations, as well as groups across the country who are looking at codifying the evidence base for addressing social determinants, especially within the context of clinical and community partnerships. There are organizations like SIREN, S-I-R-E-N at UCSF, and we're more than happy to share that link if you're unable to find it. And so there are organizations that are starting to collect this, including HealthBegins, to build up the evidence base. One quick comment on that, on Richard's really great question, is beyond the evidence, which populations and problems are more amenable to social interventions than others? And this is actually where it gets really important from our perspective to get specific. We know, for instance, that based on the experience so far of cross-sector work between healthcare and other sectors, that there's a lot of evidence right now around the benefits of housing, especially for those who are not housed or unstably housed. We know that, for instance, the evidence around the housing first strategy and others over the last several decades has now given us a strong indication that housing first is an appropriate strategy and intervention. And of course, across the country, we see health systems, large and small, entering into or building on longstanding partnerships to connect those who are homeless or unstably housed to permanent supportive housing and other forms of housing. So there is a lot of evidence around that. We're seeing a lot of evidence start to amass again around how to bring together cross-sector work around food insecurity as well. And we're seeing evidence when it comes to outcomes for patients, as well as meaningful outcomes for health systems, and of course, meaningful outcomes for community organizations as well around food insecurity. And so organizations like the Root Cause Coalition and others across the country are bringing together a lot of great thinkers. I also want to give a shout out to the Hunger Vital Sign Community of Practice, which is a great group that FRAC and Children's Health Watch have organized across the country of leading edge thinkers and researchers to identify the evidence for food insecurity. And so again, the takeaway is that it's important for us to get specific, Richard, and for others around social needs as we start to codify the evidence base that's out there. Let's move on to another question, and maybe Sarah and I can tag team here as we take these questions from Steve Reed.
Sure.
Yeah, do you want to read that out?
Yeah, sure. So the question from Steve is, so the prioritization process that I am familiar with involves an extensive process of community engagement before those decisions are made. Nothing about us without us is the mantra around here, and I agree completely. And I think I touched on this a little, just really briefly under Get Set, that as part of the readiness assessment, just so you kind of focus and start thinking in a concrete way, about your organizational readiness. We encourage you to, pick a population and pick a social need without kind of all of that background consideration. But as part of the Get Set process, and I'm hoping that we'll do webinars, on the other steps of the process in the future. I think you're absolutely spot on with the nothing about me without me. So how can we, validate the assumptions that we as healthcare providers, think are true about our patients? So we have kind of get out of the building models that we encourage organizations to do to, again, get out there, talk to your community partners, talk to your patients before you decide, what are real, priorities for them.
And one thing, and Steve, your point is, as Sarah was saying, it resonates a lot with us here. Another aspect to consider is that the nothing about us without us mantra, which we'll endorse 100%, is as true for those within the healthcare systems across the country right now, whether it's nurses or doctors or social workers on the front lines in FQHCs, or it's managers of quality improvement who are trying to not just reduce hospital-acquired infections, but also now figure out better ways to care for high-cost, high-need patients. There are scores of frontline workers in healthcare right now who are already dealing with trying to deal with the downstream symptoms of upstream problems. And are across the country increasingly motivated to partner with community to be part of the solution and to do better by their patients and by their communities. When we think about nothing about us without us, we also think about the readiness assessment that what we share today specifically again, the readiness assessment in this version for healthcare as a way to make sure that we're including them and allowing them a pathway to now check their own pulse and then come to the table with community partners in a way that's better informed and frankly framed in a way for action rather than feeling like they're not empowered to do something. So it's a really great question, Steve. Suzanne Leahy has asked another question, which is, what are the implications of different readiness levels for taking on upstream work? Is there a level you should reach before adopting upstream work? It's a really great question. And so based on the summary reports that are provided, we not only provide that graphical representation of readiness across those 10 domains, but we also lump them into 3 different categories, each domain into essentially low, moderate, and high levels of readiness to be able to align with social determinants work. What we know is that readiness is, again, from the organizational developmental research as well as from lived experience, that readiness is not a one-size-fits-all phenomenon in the collective experience of an organization. In an organization, there are domains of readiness that may be stronger than others. And what we are trying to do with this readiness assessment is to uncover the strengths as much as we are about the areas for improvement. And the reason we're doing that is because it turns out even an organization that might at this point perceive itself as being not ready to move upstream to address social determinants likely has strengths already within it. The very fact that it's operating means that they figured some things out really well. And those strengths, recognizing those strengths, might be around good project management or quality improvement. Those strengths actually provide a touchstone for building off of, to develop, again, other organizational capabilities that might get that organization more ready for addressing social needs. So we break it, the concept of moving upstream down into specific social needs, specific populations, but then again, specific domains of readiness so that we can answer that question with a little bit more specificity. It's not a one-size-fits-all. Organizations live across the spectrum of readiness, and our theory of change for health begins, along with our partners, again, in clinics and communities, is to essentially provide the roadmap so that everybody, regardless of where they are on that spectrum, has an ability to move one step higher. How do we access the organizational upstream readiness assessment tool? This is the one I imagine, this is a question from Gwen Schonkweiler. Gwen, thanks for that question. After this webinar, we'll send you a link where you can take the readiness assessment. You'll have that link for yourself. It'll be available for a time. We'll invite you to share that link with your colleagues as well so that they can participate in this. And then again, after you complete the assessment, you'll receive your summary report as well, so you can have better insight. Another question, do you want to take that one now?
Yep. Thank you both for doing this. This is a question from
Gasatata.
Yeah, thank you, Rishi. For those of us who are aspiring physicians, nurses, etc., what advice do you have for us about being upstream ready when it comes time to deal with patients?
That's a great question. I think this is where we have some thoughts, but this is where the power of our members and network partners can be really helpful. So I'll share thoughts, and this is actually just on the heels of a conversation that we were a part of the other day with a group of aspiring nurses and physicians. It's important to understand that you're not alone. If you have these aspirations to move upstream is incredible, and you're also not alone because there are others like you out there, your classmates, if not others, in other health systems, other health professional training programs, whether it's residency programs, baccalaureate programs for the courses, PAs, community health worker training programs. There's a whole host of folks that are out there, all of whom share different variations of the same aspiration. You're not alone is an important point because that's step one, I think, to understanding what it takes to drive this movement forward. Step two is to understand that because you're not alone, this work requires teams. And so it's not about having a hero doctor or a hero social worker or a hero quality improvement coordinator in any system. What we know from change management experience, what we know from what makes great systems great is that teams work together and lean on each other and identify how they can collectively move towards a shared goal. That's exactly what it's going to take here as well. So as you're aspiring to become a physician, a nurse, or anything else, or for anybody like you, I think that's our advice. Don't feel like you're alone, and also don't go it alone when it comes to moving upstream. And that goes for those who are very senior in the organizations across the country right now. This is a new endeavor for us in healthcare to think about how to partner up with the community. Let's make sure we don't do it alone. Lean on each other, and this is one way, we hope, with the readiness assessment to do that.
Sure. So I think we have time for about one more question, and then we'll wrap it up. But like Rishi said at the beginning, I see so many questions here. So first of all, just thank you. Keep them coming, and we'll make sure to follow up with you after the webinar. But just one final question from Suzanne Leahy. Interested in how to use results for improving organizational readiness for upstream work, and also with the tool support pre or post-test assessment.
Yeah, so in the slides, which will be available to you as well after this webinar, one of the slides that we talked about just briefly was the fact that we hope this readiness assessment is a chance to check your pulse now as an organization, but then to use that to track over time as you're assessing your capabilities as an organization. So the tool that we're offering right now is meant for that, that first assessment as part of the get ready, get set, and go process that Sarah talked about. And our goal is, especially as more and more of our partners take this standard set of questions, is to be able to now build up the evidence base so that not only can one organization track its own progress over time in these domains, but then also compare with others, similar organizations in the same space, trying to address perhaps similar issues. It's a great question, Suzanne, and the answer is yes, the tool would support pre-post test assessment. Mm-hmm. So we're at the close of the webinar here. I want to say we're here to help. We're incredibly appreciative of the time you spent with us today. We know you're busy, and we know you're committed to this work. We will send you a free link to the standard version of the readiness assessment that we share today. When you complete the assessment, you'll receive a free summary report as well, so you can identify, again, your highest and lowest rated areas of organizational competency. You'll also receive information on ways to partner with HealthBegins to offer the assessment to your teams, to your members if you're a part of a large organization, or if you're a large network, an association, for instance, or a foundation that supports other health systems in regions across the country, how you can offer the assessment to them as well. So please contact us if you're interested in becoming a partner with HealthBegins. This work is not alone, or to learn more about the enterprise version of the readiness assessment, which has some of these other features we talked about. And I just want to say thank you.
Yeah, thank you so much. Our contact information is up here. We'd love to kind of continue the conversation with you. So please reach out, take the assessment, let us know your feedback. And yeah, this has been great. Thank you all for joining us today.
We invite you all to spread the word. HealthBegins is proud to be part of this collective effort. We know that together, if we spread the word around ways to get ready, including this tool and others, that we'll all collectively move the needle on helping this country figure out how to better address health and social services in a seamless, integrated way, in a way that our patients and our communities demand. We really thank you guys. Bye, everybody.